Hey, you guys, here is our answer and rationale to the last question that I posted. I hope you all got a chance to go through and read it, give it some thought, maybe post your answer, post your thoughts. So let's just get right down to it. A client in sinus bradycardia has a heart rate of 45 beats per minute and a blood pressure of 82 over 60. The client reports feeling dizzy. Which intervention would the nurse anticipate next? Now, you guys know the number one test taking strategy by Apex Nursing Academy is to repeat the question. Do not drop down and try to answer anything. Don't even look at the answers. Read your question again so that you can begin to recognize those cues. Recognizing cues is just picking up significant data from the question. And you want to give your mind time to process and start focusing on what the question is asking you. That's why you don't want to drop down right away to the answers, because you'll tend to skim over the question and then pick up something that just stands out to you in the answer choices. And this is not the time to do that. During your nursing exams and NCLEX, you want to be strategic, you want to be focused, and you want to pick the best answer, not just what stands out to you, because sometimes they can throw some answer choices in there that have the tendency to stick out and flash in your mind and say, oh, yeah, that's it. But it's not the right answer. So you really have to be careful about just going down, picking the right answer. Picking the answer that just stands out to you. You want to go and read your question. Use your cognitive skills, which are recognizing cues and analyzing cues, prioritizing hypotheses. I talk about it all the time. So you want to do those things. Now, picking up on your cues, recognizing cues. Client is in sinus bradycardia, 45 beats per minute. Look at that blood pressure, 82 over 60. And the client reports feeling dizzy. So that is significant. That's a significant cue. It's asking you about interventions to do next. So you picked up on those cues, you analyze those cues, you start asking yourself, focusing on sinus bradycardia. What is it? How do we treat it? Sinus bradycardia is heart rate less than 60. This client's heart rate is 45 and it's telling you they are in sinus brady. Blood pressure, cardiac output. What are we thinking about with low blood pressure? This client's blood pressure is 82 over 60. Sinus bradycardia. Is it symptomatic? Is it asymptomatic? Well, it's it's symptomatic because the client reports feeling dizzy. So we're having some symptoms here, right? So that goes a long way in telling us what we want to do, because sometimes we may not treat a symptomatic bradycardia, right? So we're taking all of that in. We're bringing all of that nursing knowledge to the forefront, focusing in on sinus bradycardia, what's going on with the patient. We've recognized our cues. We've analyzed our cues. We're prioritizing our hypothesis, and that just means we're thinking about what's going on. We're thinking about client needs and prioritize them. Thinking about your ABCs, airway, breathing, circulation. Is it symptomatic? Remember, I said we look to treat. Asymptomatic, we may just monitor. Now we have all of that in the forefront. Now we can go and look at our interventions and choose the best intervention. So now let's look at those answer choices. Defibrillate the client. Well, defibrillation is used when it's pulses VTAC and VFib. This client is in sinus bradycardia with a heart rate of 45 beats per minute. So there's no need to defibrillate this client. We're going to eliminate that answer. Administer oxygen. Administer oxygen sounds really good, because it's part of those priority interventions, because it goes along with ABCs, airway, breathing, circulation. Airway is always number one, and oxygen, administer oxygen. That's good. It sounds good, but they didn't tell us our client is in any kind of respiratory distress. We can't add on to what's going on with the client. We have to only deal with the cues that we have, the significant data that we have. So we have to eliminate administer oxygen because there is no sign of respiratory distress. Moving on to C, prepare for transcutaneous pacing. Now, transcutaneous pacing, that is a valid treatment for sinus bradycardia. So we're going to keep that in mind. We're going to look at that next answer just to see, what it's saying, what's going on with that. Continue to monitor the client. Continue to monitor the client, maybe, but our client is symptomatic. And remember, symptomatic bradycardia, we need to treat. Asymptomatic, maybe we can just monitor the client, let the doctor know. But symptomatic bradycardia, we are looking to do an intervention. So after we've gone through our answers, I mean, it's pretty clear we've eliminated all but one. Prepare for transcutaneous pacing. That is the valid intervention that we are going to do next, and that is the correct answer. So thank you guys for going through that question with me. Thank you for your thoughts and your comments. I'll continue to post questions and breaking them down. And it may seem like a process as we're going through it, and I take my time and try to break down questions, but the more questions you do, you'll form a habit of recognizing cues and analyzing cues. All these cognitive skills will become a habit, and you'll go through it a lot faster. I'm taking my time and going through it to break it down, but if you practice questions and you continue to use your cognitive skills, you will go through the questions a lot faster. But I just want you to see the process of how to answer these questions, okay? You guys have a great day, and I'll see you next time. Bye-bye.